Hi, I'm Oliver Sharp, and this is Fresh Perspectives from AMP Recover. Very excited to be joined today by Dr. Anthony Romeo, a leading shoulder, elbow, and sports medicine specialist, as well as the chief medical editor of Orthopedics Today. Dr. Romeo, thank you so much for being here. How are you today?
Very good, Oliver. Thank you for the opportunity to speak with you today.
Well, it's certainly great to have you here. Let's start with COVID-19. We've seen the coronavirus pandemic really wreak havoc on the healthcare landscape over the last few months. What changes have you noticed, both in healthcare in general, as well as in orthopedics specifically, that you think are going to remain in place long term?
I think a couple of really critical issues. Number one, we've learned that orthopedic surgery is primarily driven by elective surgical procedures. And the fact that patients have an opportunity to choose when to have their surgery, in many cases, more than 85% of the cases, led to the reality that with the virus causing this infection and how it affected our abilities to provide health care, that we essentially stopped elective orthopedic surgery. It really sort of devastated the actual business of orthopedics for at least 2 months, and it still hasn't recovered, and it's likely to be probably another 6 months to a year before we get close to where we were in the past.
Certainly a long tail recovery ahead of us, as well as a lot more changes on the horizon as well. Historically, medicine has really been based on face-to-face interactions between provider and patient. Obviously, that's not possible during the coronavirus pandemic. What are we seeing as far as adoption of virtual care, telemedicine, and some new techniques and technologies to really be able to provide efficient and effective care in the new normal?
Well, it was very interesting. I remember since I was in New York, so we really were the epicenter in March and April, that we first started talking about wearing masks in our offices. And a lot of people, and even some healthcare centers said, you can't wear masks because it makes people feel uncomfortable. So there was a big opposition to that. And really what happened is that as society realized what an incredible pathogen this virus was, and that we all are in this together to try to prevent it from affecting as many people, that it really opened up a lot of different avenues of how to connect and communicate with your patients. The idea of telemedicine has been around for a long time, and a lot of people have been sitting on the sidelines saying, when is this really going to take off? Well, it's here for good now, and it's affected us in all aspects of our care. And there's two reasons why. One, the patients accept it. They didn't want to come in because they were worried about being infected. And two, the government and the insurance companies are reimbursing for it. They've validated it as an effective way to care for people. And so with those two incentives, we now have a much more robust component of telemedicine and telehealth throughout the entire system. So I think that it's going to be a part of what we do in providing patient care, patient access, and patient satisfaction for the future.
A peripheral benefit of implementing all of this technology is access to more data. We can collect data from clinicians. We can collect data back from the patients. I know you're a leading researcher. How do you think this data is going to help you and your colleagues ultimately improve care for patients in the long run?
Well, we were going through this digitalization of health, and therefore the digitalization of our research as this pandemic has hit us. So we have all recognized the incredible growth of wearables and what a watch can tell you about yourself and other types of devices that can monitor what's going on in the body. So that whole technology has now been expanded to the point that we can use that in conjunction to amplify our abilities to care for patients in a couple of different ways. One, we can monitor them to make sure that they're making the progress that we would expect, and we can even set parameters so that it's not like a constant burden, but if they're not gaining their range of motion or not doing their exercises over a period of time, our office will be alerted and say, there's something not quite right here, you need to look into it. We didn't really have anything like that. It was always had to be patient driven. The patient had to call us and say, hey, I don't think things are going as well as I'd like, or their therapist would call us. So I think the technology being patient-based technology is going to expand our abilities to monitor our patients in a positive way, to modify and improve some of our post-surgical or post-treatment protocols that we have. And with that, we'll have a lot of data that will allow us to be able to look at this information and decide which protocols seem to be associated with the best outcomes. So I think it's going to be a very interesting time over the next few years as we put all of this together.
That's excellent. Technology will definitely add some benefits. I do think that rehabilitation will remain mostly relationship driven. And I'd love to hear your thoughts on the relationship between the surgeon, the patient, and then the physical therapist in regard to orthopedic rehabilitation. How important is it for all of those people to be collaborating in order to achieve a positive outcome?
Well, I think that one of the things, if we just look at the field of orthopedics in general, and again, supported by what we saw with the devastation of elective surgery, out of all the medical subspecialties, orthopedics is the most consumer driven of all of them. And it's because of the elective nature of the work that we do. Patients can be recommended or can identify the fact that they have a musculoskeletal problem. And then what do? They're going to look online. They're going to talk to their friends. They're going to find out who's been to these doctors. Very, very highly consumer driven. So I think that's critical as orthopedic surgeons. We have to recognize that. And we have to recognize that the patient experience is really a critical aspect of that. And as we look at the physical therapy, it used to be physical therapy was more like a health club. In other words, it had to be within 10 minutes of the patient's house or there was non-compliance. Actually, now the surveys show the most important thing is the coordination of care with their treating physician. And so that is a critical point to understand too, because what that means is that I, as the physician, if I'm treating a patient and I believe that therapy is going to be valuable for them, I can't just write on a prescription, evaluate and treat. I've got to give a diagnosis. I've got to give my recommended treatment protocol that hopefully will be online. So both the therapist and the patient know exactly what it is and will follow it. And if there's deviations, whether from the therapist telling us or a monitoring device, then we can intervene and improve the postoperative outcome. So I think the role of the therapist is critical in the outcome of many of our patients, particularly in the world of sports medicine, where we're not trying to get people back to participation. We're trying to get them back to performance, to the highest level that they potentially can do. And to be quite honest with you, even with telehealth and teletherapy, we recognize that while it can be very valuable for many of our patients, it still is an important role for a personal interaction, either virtually or directly, with the therapist and the patient to really drive them to get their highest level of performance. So it's a very integrated healthcare and digital world that we've stepped into, and we have to embrace it and use the technology to improve our patients' overall outcomes.
Well, Dr. Romeo, certainly challenging times in healthcare, but creating some exciting advancements, I think, in the technology front. Thank you so much for joining us today. Really appreciate your insights. Enjoy the rest of your summer.
Thank you very much for the opportunity, Oliver. Have a great one.